the Board of Health. And I certainly wish that it was under better circumstances. But I want to thank you all for coming together for this unprecedented event. So I came in a few minutes late, but I heard Deanna say that I will call roll call and you all will indicate your presence. So why don't we begin then with the calling of roll call. So Rosa, I see you on the screen, but I don't hear you. Is it okay if I just see her on the screen, Deanna? You can just nod yes. Okay.
Please hold the space bar down if you're on a tablet to unmute yourself.
There.
There, okay, Rosa, there you go.
Yeah, good. Yes.
Okay. Gail.
Here.
Okay. Pamela.
Here.
Joel.
Here.
Susan.
Here.
Lynn.
Here.
Karen.
Here.
Sixto.
Yes, here.
Okay, and I know that Mitch is unable to attend. And so we also have on the line with us, Amiko Utsubo, who you all know and is now my Chief Operating Officer. There is a high likelihood that I will get pulled away to do a press conference with the mayor. And so if and I apologize, I don't know which camera to look into. So
That's good right there.
yeah, here we go. So if I get pulled away, Amiko will then continue chairing the meeting. We also have Corinne and Beth, who will be doing presentations for us. We also have a stenographer on with us, and then some other folks that are listening in. And then if it was not made clear, we are live streaming this on YouTube. So there's all sorts of precedents happening. So Roz, I'm going to be leaning a lot on you in terms of the protocol for this. So I've already called the meeting into order. I've done roll call.
Yep.
I don't think that we have any minutes to approve, right? So
No, we're going to go straight. We're going to go straight into the order, Commissioner, that you had signed on the 25th of March. And then now we are asking the board to continue.
okay, and so then Corinne will be doing the first presentation.
The first presentation I thought was on the congregate shelters, or we can switch the order if we're doing the daycare centers first, which.
No, that's fine. I was gonna say, so we'll do the congregate order. But before we do that, I was gonna give just a high level overview of some situational awareness so that the board is as up to date on where we are with regards to this response as possible. So clearly we are in unprecedented times with this pandemic. Certainly in the public health community, you know, for years we've talked about the likelihood of a pandemic, but in my mind, there is certainly a night and day difference between talking about it from an academic perspective and actually living through it. I think that any of us who have ever been involved in planning for pandemics and developing tabletop exercises around pandemics could have ever anticipated the types of circumstances that we are met with almost on a daily basis. And it has been a tremendous effort on the part of the health department, but really on the part of every single city agency. And now with the stay-at-home order, clearly every New Yorker has a role to play in this. Please give me 1 second. And the response obviously continues in earnestness. We are at above 50,000 New Yorkers that have been tested positive, and clearly that is it's a low number because of all of the people who are home following our instructions to stay home if they've got mild illness. We have crossed a very sobering milestone with over 1,500 New Yorkers who have died because of this illness. And the reality is that we are not even in the bad part. And so it's a time that calls on all of us to dig deep and to really put into play all that we have available to us to contribute to this citywide effort. And what we're telling New Yorkers, and clearly we are all adhering to in one way or another, is that the most important thing for all of us to do now is to stay at home, and that staying home saves lives. And the reality is, as I have said in the past, that every single one of us is touched by COVID-19, not only because we all have to stay at home, but because there are those of us who will or have developed the illness, who will know someone who developed the illness, who will have a loved one who is hospitalized because of the illness, and unfortunately may also know of people who die because of the illness. And it's a time that's really going to draw on all of us and to draw on our reserves of not only resiliency, but of our grit, because it's not going to be easy. And there are going to be incredibly trying times ahead of us. And as I've also been saying, you know, it's a time for us to be separated physically, but certainly not spiritually, emotionally, or morally. We need to draw upon our collective strength as New Yorkers to be there for one another, because it's slated that April will be even worse than March, and May will not be any better. We are going to be in this for the long haul. And the reality is that how long that time frame will be will depend on all of us and our ability and our commitment to staying indoors. And if and when we have to go outdoors for essentials, and we have no choice but to go outside, then of course we want New Yorkers to use face coverings. I want to be very clear that we are calling these face coverings. We are not calling them face masks. There is a distinction between face masks that we want healthcare workers and first responders to have access to. But we certainly want to acknowledge that, as we've been saying in the past, that if a New Yorker is symptomatic and they have to go outside, they need to wear a mask. Now there's new evidence that there are people who can transmit infection in the pre-symptomatic period, so that using a face mask when you go outside and you are unable to keep 6 feet distance from your fellow New Yorkers, we want this to be a new layer into our layered approach of preventative measures. So there are many other aspects to this response that I won't go into, but that I know many of you are intimately involved in your everyday lives, either through your presence in hospitals and clinics and offices, or through your efforts in the social services sector. So all of you, I want to thank you, not only as Board of Health members, but in your roles in civic life and certainly in your commitment as New Yorkers. So thank you all very much. I want to then turn it over to Beth, who will take over the next part of the presentation. And again, I want to apologize ahead of time if I get pulled away into meetings that are happening, or if I have to suddenly dash for a press conference with the mayor. So thank you all. I'm going to put myself on mute and then.
Dr. Barbeau, can I interrupt you for 1 second? I think it's important for us as a board to acknowledge your heroic efforts and all you're doing for the city of New York. Your videos and your guidance has been so reassuring, and you've been such a steady presence. I just want to say thank you and keep up the good work.
Thank you. Thank you. Okay, Beth, take it away.
Thank you, Commissioner. Can everyone hear me? Great. So my name is Beth Malden. I'm the Deputy Commissioner for Emergency Preparedness and Response at the New York City Health Department. Also joining us today is Ben Krakauer and Heather Reuter from New York City Emergency Management. I'm here today to present to you for ratification the Commissioner's Order for Provision of Non-Congregate Shelters signed on March 25th. Next slide. So first, before I summarize the order, I'd like to highlight that this order was developed to allow New York City to receive FEMA reimbursement for non-congregate sheltering. In short, this order declares the COVID-19 pandemic as a public health emergency in New York City, and it requires agencies typically responsible for providing shelter to provide non-congregate sheltering to the best of their ability to persons needing to be isolated or quarantined in order to prevent the spread of COVID-19. Next slide. As you are all aware, and you just heard from the Commissioner, there is currently a pandemic of novel coronavirus, also known as COVID-19. Yesterday it was nearly 1 million. Today we're over 1 million worldwide and tens of thousands in New York City. On March 11th, WHO declared a pandemic. Next slide. The virus is contagious and can spread to people who are in close contact with someone who has COVID-19 and can live on surfaces that people frequently touch. We're urging all New Yorkers to practice social distancing to slow the spread of COVID-19, which means limiting physical interactions with each other. Individuals who are sick should remain home and should avoid contact with others as much as possible. Next slide. To support New York's response, on March 20th, the President issued a major disaster declaration for New York State, including New York City. This authorizes FEMA to reimburse New York City for certain emergency protective measures, which can include non-congregate sheltering. Next slide. Typically, FEMA reimburses for congregate shelters, which are shelters that are set up typically in large open spaces such as school gyms or civic centers. These are most frequently used after a hurricane to support evacuation operations. As you can imagine, it's difficult to practice social distancing in these types of settings. Therefore, in unique circumstances such as this, FEMA will reimburse jurisdictions for the cost of non-congregate shelters to prevent the spread of illness, such as using hotels or dormitories. Next slide. To assure that New York City is able to receive reimbursement, this order was developed and submitted along with our request to FEMA to support non-congregate sheltering on March 25th. FEMA conditionally approved New York City's request for the order on March 30th, and this approval extends until April 30th. We may need to issue an extension beyond April 30th, depending on our needs at that time. As a reminder, and you heard from the Commissioner, we are in extraordinary times and the city is taking extraordinary steps to keep people safe. This Commissioner's order is an essential requirement for New York City to be eligible for FEMA reimbursement for non-congregate sheltering, and will eventually be a key component in New York City's financial recovery once this emergency ends. With that, I will close and open it up for questions.
You've limited the order says that you've limited it to specific city agencies. Can you tell us a little bit about that?
So the agencies mentioned in the order are ACS, DOC, Department of Corrections, DSS, Department of the Social Services, and DYCD, but it's not, I believe it's not just limited to those agencies. It's any agency that provides congregate sheltering. And I have my NICEM colleagues on the phone to help answer any questions as they're running the program, the hoteling program that is aiming to support these non-congregate shelters.
Thank you. Are we ready for a vote?
Does anybody else have any questions?
I do.
Yes.
Can you hear me? Okay. So just for me to understand this, you've issued the order already and the order is effective through April 30th. So what we're doing now is approving an extension of that order if it's necessary.
So this is Rosalind. If I could answer that. So the commissioner pursuant to the health code has the authority to declare a public health emergency and to issue orders as appropriate. But under that provision of the health code, that needs to get ratified by the board as soon as reasonably practicable. So that is what you are being asked at this point, to basically continue the issuance of the order that the commissioner had signed at the end of March.
Okay,
And,
thank you.
and Roz, it's Ben Krakow from EM. If I could also just add, the conditional approval from FEMA is what's through April 30th, when they will accept and allow us to be reimbursed for non-congregate sheltering. As Commissioner Barbeau mentioned, if this pandemic continues and there's a need beyond April 30th, we'll request additional authorities from FEMA to continue that beyond that date. I don't believe, but defer to Roz, that you would need to re-ratify the order. I think it's more administrative in the city.
Correct. We won't. Yes, that's correct. Won't need to go back to ratify the order.
Got it.
But I'm sorry to have to do this at this time. I don't know if there are other additional questions, in which case they should be raised as well. But I'm just being asked for this order not to be voted on at this exact moment. So if there are no other questions, if there are, obviously we'll go ahead with the questions or the discussion around this proposed order. But if not, then we should move on. If we could please move on to daycare and then go back to this one.
There are a couple of us with our hands raised.
Okay, perfect. Thank you.
So can we just take those questions then, Roz?
Yes,
Okay.
definitely. Thank you.
All right. Go ahead and jump in, because I don't know who's waiting to ask for a question. I'm a little technologically,
Okay.
Oh, here we go. Joel.
Okay, yeah, I see myself and Lynn. I can see it in the bar. This may or may not be related. I was just going to ask about non-congregate changes in other places in the city, controls like New York City jails, and whether that's at all related or that's something completely different.
Beth?
Ben, do you want to be able to speak to what's happening in the jails?
Sure, Beth, thanks. And my colleague Heather can also jump in and give some. Heather, do you want? Yeah, so we've been working very closely with the Department of Corrections. Every individual that needs to be released from jail, either have their release date made early or altered, requires a judicial order. So the Mayor's Office of Criminal Justice has been working very closely with counsel, both at the prosecutor's offices and defense counsel, to release those individuals. As those individuals are released, they are being welcomed into the non-congregate sheltering program that we're running. Heather, do you want to add any clarity?
So they're staying in the prison system, but they're going to a different location?
It really is very nuanced depending on each individual's legal circumstances. In some cases, they are being moved. I think the important part from the public health perspective is they're being moved out of a congregate setting into a non-congregate setting. But each person has a different legal status.
Yeah, no,
Heather,
I'm sure that's true. I'm sure that's true. Okay, thank you.
Thank you very much.
Okay, and then I see a question from Lynn.
And then I have a question too. I don't know how to raise my hand though.
Okay, let me go to Lynn first and then I'll get you.
Go
Pam.
ahead, go
Yeah,
ahead.
thank you. So I have a similar, though more general question. Is there any immediately available data you can share with us about the type and number of non-congregate shelters that have been set up by the various city agencies at this point? I recognize it's still a work in progress, and we just heard about Department of Corrections. Is there anything else you could share with us?
Ben, you can take that. Or Heather.
Actually, Heather has all the data.
Okay,
Heather?
Heather.
This is Gail. Can I jump in? It's not a question of congregate shelters. The congregate shelters that the city's operating are still in operation. The DHS shelters, the DYCD shelters, ACS, and so forth. And what this is about hotels and congregate settings for people who have COVID-related illness who need to be isolated.
I understand that, Gail. I asked about non-congregate sheltering options. Could we hear the data, please?
So Lynn, are you asking of like shelters to decamp patients to?
No, I'm asking about whatever the city agencies who are affected by this order, wherever they have started moving the persons they were previously responsible for. I'm asking for information about that. Again, we just heard from Department of Corrections that they're being moved to other locations. I assume some of those may be various kinds of alternative housing and what have you. I just like whatever information is available about what kinds of persons are being moved and to where they're being moved. It's a general question. I understand what the order calls for, and I assume the agencies are acting on the order. I'd just like to know something about the scope of what's been happening.
Sure. I'm not sure that we have that data aggregated right now, but we can certainly follow up with the board and provide that information.
Okay, that'll be fine. Thank you.
Great. Thank you.
So,
Pam, you had a question?
Yes, I did. So during the hurricane, the last hurricane, there were these, I want to call them group homes, but that's not really it. They're sort of private. There's a whole bunch of them in Southwest Brooklyn and near the shore. And they behaved in a very unaccountable way. They put all these people in buses and shipped them to Maimonides. Now, and I say that only because there are entities in the city that are not under the purview of the city, maybe not even really the state, except for character and competence. And so the question arises for me, is there anything that the health department is able to do legally to try to get them under the same umbrella, even though they're not city agencies or state agencies, you know?
Yeah, that's a tough one.
I know. It's always been tough. They've been totally unaccountable, but there are people there. I don't know.
Right. I will gladly take a lifeline from any of the folks on the panel who want to offer. But, I think that the easiest thing or the most accurate thing that I could say is we've been in communication with our counterparts at the state. And we are looking at all ways in which we can meet the needs of, the various congregate housing settings.
Yeah. Okay.
Dr. Barbeau, this is Gail. To Dr. Richardson's question, the people who are going to be moving are in congregate shelters now, Dr. Richardson, and they're being moved into settings where they can be isolated. It's a slightly different question. I'm sorry I didn't answer it properly, but right now in the shelter system, people are often in congregate settings and that are closer than 6 feet with no ability to isolate or in any way keep people apart. So these,
yes, I understand.
I think, to move people into those settings where they can be taken care of in a different way. So it's not that there's no congregate settings, it's just that they're currently living in a congregate setting. I don't know if that's clear.
Yes, thank you. I understand the situation and what the order calls for. I was just asking about the places to which they were being moved.
Oh, I see. I'm sorry. I didn't understand you were asking about the
What
hotels.
facilities have been set up, what alternatives
I'm
have been
sorry.
identified.
Answering
That's
the
what I
wrong.
was asking.
So emergency management has been working closely with hotels across the city who have generously offered to participate in this program.
Mhm.
Ben or Heather, do you want to just add a little detail?
Thank you.
Yeah, predominantly these individuals are being housed in hotels that the city has contracted with, either directly or through a hotel broker. And I think if it's okay with the commissioner, we do have some high-level statistics that we can share.
Sure, we can follow offline on that.
Okay.
Thank you.
Great. Any other questions on this topic? All right. Oh, wait, Rosa.
For those hotels that the city is setting up, who will be providing the care for those patients?
Well,
They're not patients.
those
And
are
you
not
take that?
necessarily patients.
Right. So the people that are going to these hotels are individuals who don't need hospital care, but we recognize that many of these individuals are coming from settings where they have lots of wraparound services.
Yeah.
So
Right.
New York City Emergency Management have been working with their home agencies to identify ways to provide those services for at the locations where those individuals are being moved. But to be honest, this is really difficult, and staffing just across the city is really difficult for all disciplines.
That's
Ben,
the
do you want to add
reason
anything?
why
I mean, that's a problem now, but
Absolutely.
before this. So,
Okay, any other questions? All right, so Roz, if I hear you correctly, we're still gonna come back to this one, but we'll move then to the next presentation. Roz? Can you just shake your head because you're on
Yes,
mute?
no, can you hear me? Yes, that's correct. If we can just move on to the daycare one for now.
Okay, great.
Thank you.
So then I'm gonna pass it over to Corinne.
Good afternoon, Corinne Schiff, Deputy Commissioner for Environmental Health. And I'm here to propose an additional COVID-19 mitigation measure to the board, that the board close childcare programs operating under Health Code Article 43 and 47, to close those temporarily, except for the emergency programs that are operated by the Department of Education.
so what's happening now?
So I was going to start by reviewing current conditions for
Can I ask
childcare.
members just hold your questions until we get through the presentation?
Of course, the board knows that public and non-public schools are currently closed. State-regulated home-based childcare is open. And Article 43, which are school-based childcare, the department has recommended that they close. There are about 500 of those programs with a total capacity of about 7,500 children, ages 3 to 5. We believe that most of them are likely closed because their associated school is closed, but they can be open, and particularly those that are not located in the same place with their school building, their ongoing school might be open. Article 47 childcare centers, we have likewise, the department has recommended that they close. There are 2,250 approximately of those centers with a total capacity of 140,000 children ages birth to 6. And our best information about current operations is that about half of the centers are closed. It's a requirement of the health code that they notify us when they close voluntarily, and about half have done so. We have done some proactive research the week of March 15th. We placed calls, and we confirmed that at that time, about 360 were open with a capacity of about 16,000 children, but we weren't able to reach 1,000 of them. That could be some of them had closed but didn't notify us, or it's possible they were too busy to pick up the phone. And anecdotally, we know that many childcare centers are closed, even if they haven't notified the department. But we also know that there are many that remain open, and some have closed and then reopened. Next slide, please. So the Department of Education has opened emergency childcare. They have regional enrichment centers called RECs. Those are in DOE buildings serving children 6 months to 12th grade. And also emergency childcare called X. And those are in community-based programs operating under a contract with the DOE, and those serve children 6 months to 5 years. And these are available to caregivers, including healthcare workers, first responders, other essential government employees, and food workers. Next slide, please. The DOE services are broadly available. There's sites in every school district. They're open from 7:30 in the morning to 6 in the evening. DOE has immediate availability and can expand as needed. The department worked very closely with the DOE, and they have put in place mitigation measures that align with our citywide strategy. So the availability is limited to promote New Yorkers staying home. They have capped the number of children and staff in each classroom to better enable social distancing. They've incorporated regular hand washing into the day. There are daily health checks. There's a nurse on site. There's an isolation area. And there's routine cleaning and disinfection that focuses on high-touch surfaces. And there is information about COVID-19 available for families. So in light of this, the department is recommending to the board that they temporarily close Article 43 and 47 childcare programs in order to slow the spread of COVID-19. There's an exemption in the proposed order for the RECs and the X, including to allow those to expand as needed. The programs would have to close before Monday, so today or over the weekend would be the last time that they would be open, and they would reopen when school reopens. But there's also a clause that authorizes the commissioner under certain circumstances to reopen. And I'm happy to take questions.
Okay, so to remind folks, there's an option on your panel to raise your hand and ask questions. But if you want to just pipe up and I'll call on you, we can do that as well. Any questions for Corinne?
Hi, this is Karen.
Yeah.
Thank you. I just was wondering, you know, you showed us the numbers for capacity of the daycare centers and school-based early childhood centers, around 150,000. Just wondering what and I see that there is availability now in the RECs and the X, but just wondering what the capacity is for those current facilities.
So the Department of Education has a capacity right now for 31,000 children. And as I noted, the ability to expand, there is availability now, and they're monitoring that, and they can expand if they need to.
So we feel like they would be able to expand if the need, you know, which I imagine it might surpass their current capacity. Do you know how much capacity they have to expand?
So I also want to clarify, the 140,000 is the total system capacity for Article 47 programs, but we believe that about half are closed. We don't have numbers, so 70,000 would be the capacity, but we don't have the data on how many children are actually going every day. And so to your question, the DOE has assured us that they can expand if they need to, both into their own buildings, but also by contract with the center-based programs. And then the order is drafted to enable DOE to do that.
Right. I think we should, you know, monitor or track that pretty carefully because of the challenges now in the healthcare system for staffing and other essential workers, that we try not to create barriers to their going to work. But it makes sense what the proposal is.
All right, good. Thank you. Joel.
Yeah, thank you, Commissioner. I guess I was just going to follow up on that. If there's about 70,000 kids potentially still attending Article 47 sites, if I got that correctly, not all of them would be from families where the parents are essential workers. So some of them would not have the option to go to the, appropriately so, to the recs and X, but only those who are essential workers, healthcare providers, public transit workers, et cetera, grocery store workers would be able to access those. Is that correct?
Correct. So the childcare, the Article 47 programs that are not part of the DOE system would be closed, and parents or caregivers who need to access DOE childcare would only be able to if they qualify for, if they're eligible for DOE, and that's really the same as for young children in DOE schools, which are also closed. So parents also need care for 7 and 8 year olds, and that is a strategy that the city has implemented to promote people staying home and as a mitigation measure. But yes.
Yeah, thank you. It makes sense. I mean, that's what we're asking everyone to do. I think we all have friends and colleagues who are struggling with working from home while caring for young children at home. That's just one of the sacrifices and challenges of the situation. But it also means that it's not 70,000 kids that would flood the EC and REC system. It's some proportion of those, and there's probably no way to know what that is.
Yeah, great. Thank you for that. Lynn?
Yeah, I mean, I certainly understand the need for this. I see no way to avoid it, but I am concerned about the impact that this has on families who, where the adults do not have jobs where they can work from home. And I recognize that this will create a financial hardship, often on the segments of society which are already most vulnerable. But with that said, I do want to just ask about the emergency childcare centers for healthcare workers and government employees and food workers. I wonder how narrowly construed those essential jobs are. And I don't know the process. I have not attempted to, obviously, to get any children in there, but there are many allied and related jobs that support both the healthcare system as well as making food available. It's not just food workers per se. So how stringent are these requirements? Are we sure that we are not forcing people who ultimately are integral parts of our supply chain to not be able to go to work, and that this will actually interrupt essential goods and services? I just wonder how those requirements are being interpreted and enforced in those centers.
Well, I can say that the Department of Education they have expanded eligibility as they have been able to evaluate how many people are accessing them. There is availability, and I can certainly relay to colleagues at the DOE that the board encourages them to continue to monitor availability and accessibility, and to consider expanding eligibility requirements for people who need to work to keep the city going. And again, it's a challenge for both parents with young children who are childcare age, as well as school age children, but not able to be alone during the day. But I understand your question, and I will certainly relay that concern.
Yeah, there's so many things that none of us ever thought of that turn out to be essential now. And so I just don't want us to construe it so narrowly that we actually do ourselves a disservice.
Good point, good point. Any other questions? Okay, so then.
Oh, wait, it's Pam.
Sure.
Sorry. So I'm just reflecting kind of on the date. This particular piece is tied to the school year. The first emergency declaration of what has to be done is tied to April 30th. And then, does it have it has an option? It just reminded me, I meant to clarify. And then you can renew it without coming back to us, or you have to come back to us? So much work for you.
This is on the, about the childcare.
Well, no,
order.
the child, I mean, I think the end of the school year, like the end of June makes sense. And then you will just need to take stock. But I mean, to the extent that different of these things has different authorization end dates, I'm just trying to see if there's some way to make this more streamlined from your perspective, so you're not stuck coming back here a lot,
So
you know?
yes, thank you. The order is written so that it lifts at the time that the public schools are open,
Right.
with additional flexibility for the commissioner should conditions meet.
Right.
And I think the other dates are tied to other issues. So I think
They
can't
right.
quite streamline.
No, I know that. I was, okay, it doesn't matter. Forget it. I know that.
It's not, for example, like the governor's order or the mayoral orders that require, like when there's a suspension of laws that you need to go back.
Okay.
Whether it be 30 days or 5 days. That's not what this is.
No, I know that too. Right. Okay.
Yeah.
Fine. It sounds like it is what it is. Okay, fine.
Any other questions? Okay, so hearing none, let's go then to restating the motion. I'm not controlling the dashboard, so if we move forward, so we've done discussion. Now we're going to go for a vote. Is there a next slide?
Do you want me to just state the proposal?
Yeah, please, because I don't have that in front of me.
Yes, that the board ordered childcare programs operating under Health Code Article 43 and 47 temporarily close, except for emergency programs operated by the Department of Education.
Okay, thank you. All in favor, say aye, please.
Aye.
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 All opposed? Any abstentions? Okay, the motion carries unanimously. Now, Roz,
Yes.
do we have enough to go back to the other?
Yes. Yes, I now do, if everyone can hear me. So with the non-congregate setting order, there was a conflicting statement that was found in the order. The sentence that states that the shelters shall be under the control of the Commissioner of Social Services. So we are going to ask that the board approve for the removal of that sentence.
Yes.
OEM has control over the contracts for the hotels and being managed by the agencies responsible for the populations being placed in the agencies. So that sentence is really inconsistent with other pieces of the order. So we're just going to remove that sentence and ask the board to approve that modified order.
Okay.
Any questions? Okay.
Can you show us the sentence you're taking out, Rod?
Oh, I don't know what it's in the, I don't know why I can't, we can scroll down to paragraph 2. Let's see, okay, good, keep going.
Part.
It's in, yeah, now therefore, yeah, you see, in the second paragraph in 2, such shelters shall be under the control of the Commissioner of Social Services.
Okay.
Thank you.
Move ratification of the order with the exclusion of that sentence.
Right. Second.
Second, great. All in favor?
Aye.
Any opposed? Any abstentions? The motion carries. All right, so thank you all very much. And we have taken steps to further the response to COVID-19 here in New York City. I want to thank you all again for making yourselves available. And I wish you all health and safety and connectivity with those that are around you. So thank you all very much. And we are adjourned.
Thank you.
Thank you.
Thank you.
It's very nice to see everybody, actually.
Very,
Thank
very.
You all.